So we kind of talked about today, the whole elimination diet and how I don't love the name. I like to think of it as the addition because we're really focused on adding nutrient dense foods. So the goals of the elimination diet are one, identifying food triggers. We're really trying to untangle the inflammatory web that we've created through all sorts of different environmental toxins, food, different things, but we're trying to untangle that and decrease inflammation. We want to help support our body's ability to detoxify. So just reducing that overall toxic burden and really supporting the liver. We're not so much focused on calorie restriction and counting calories in this program because it's more surrounded on whole foods and foods that fuel our body, as we talked about earlier today. We want to promote body awareness to food. So, for example, with reintroduction, we want to find connections in how our body responds to certain foods. So, it's all about creating this balance, centering ourselves, and just being more aware, creating a space to heal and focusing on gut health and really healing and sealing that gut lining and focusing on that gut microbiome, which we'll talk about here in a minute. So, the questions we like to ask are, what are your unique needs? How does food influence your health? How does food interact with our biology? You could do all of this expensive testing for food sensitivity, which sometimes we do and sometimes it's appropriate. But the gold standard really is the elimination diet because here we're able to see really how foods interact, decreasing that inflammatory burden and really identifying how the food impacts us and our unique needs and influences our health. The gold standard really is the elimination diet. We can do all this fancy testing through food sensitivity, which is appropriate at certain times, but the elimination diet allows you to tune in to those symptoms that you may not have been aware of in the past, but it really picks up on even mild changes. So it is really considered the gold standard. I think of allergies, there's many ways the body reacts to food. So immunoglobulins are basically antibodies that are designed to protect us against invaders. And so when you think of an allergy, like a prophylactic reaction, that's an IgE immune reaction. And so that's more immediate. You've got hives, you've got swelling, that anaphylactic response. Well, more commonly, we have these intolerances or sensitivities. And so this can result in one, it's a much more delayed response, but also you have so many different types of symptoms. So it can present in so many different ways, from symptoms ranging from brain fog, hyperactivity. It could be weight gain, mood disorders, sleep disruption, eczema, joint pain, acne. I mean, you name it, it can present in so many different ways. And so when we're doing an elimination diet, we're really able to kind of remove some of those inflammatory foods and then slowly, one by one, reintroduce while paying attention to those symptoms and really tuning in to how our body responds to those foods. It's much different than a true food allergy per se, but it's still just as important to our health to be able to determine how we're reacting. I talk about leaky gut because this is such a big part of our health and how food reacts to our immune systems. So I think of the GI system as this big coffee filter. When we have that cup of coffee in the morning, we don't want coffee grounds in our coffee, right? We want our nice cup of joe. Well, the same goes for when we absorb food. We need to have tight junctions. We don't want these whole proteins to be leaking easily across the gut barrier. So we need these super tight junctions. We need those vitamin and minerals to be absorbed, but we can't have these loose gaps or large gaps in our gastrointestinal tract. Things that can cause that are inflammatory foods, these food sensitivities that I mentioned, processed foods, medications like NSAIDs, stress, infections. So many things can impact our gut health. But the start is inflammatory foods. So there's this physician, he's world-renowned pediatric gastroenterologist, and he was coined saying all disease begins in the gut. And he talks a lot about zonulin, which zonulin is basically a protein that is in charge of kind of that permeability within the gastrointestinal tract. And so if you have elevated zonulin levels, that can widen these gaps, allowing proteins and these inflammatory triggers to leak into your bloodstream, causing that more robust immune response. So we don't want that. And our goal, again, is to have that coffee without the big grains in our coffee cup. So we want to create those tight junctions. And so kind of what happens is you've got the inflammatory foods and bad gut bugs that release zonulin. So then you've got the passage of that epithelial barrier, allowing these pro-inflammatory cytokines, which are basically proteins that trigger that immune response. And then it increases your risk of increased permeability. So it's this vicious cycle. And so we are here as the starting point to really focus on the elimination addition diet to identify those food triggers and eliminate them, and to really focus on our gut and what we can do to heal and seal and create this more robust immune system and healthy gut barrier. So how do we prep for the elimination diet? Well, the most important thing is preparation. You have to be ready. You have to have your ingredients and your grocery shopping list. You have to be mentally prepared and have that list in front of you. The supplies that you need, some recipes that you want to have laid out. You want to be excited for this because it can be a little overwhelming, especially if this is your first time. So in this elimination diet, really in the first month, those first 4 weeks, we're focused on removing those inflammatory foods. And so those are going to be very individualized. So on that first visit, we determine which foods are, we're going to focus on removing in that first 4 weeks. So it could be gluten, it could be nightshades, it could be eggs, it could be dairy, it could be a combination of all. So that's kind of the first 4 weeks. We're just removing those inflammatory foods. Then at that second visit, we'll talk more about reintroducing those foods. And usually what happens, we're reintroducing one food at a time every 3 to 4 days. So if you recall, it's kind of like babies introducing foods. It's slow and you do it, in a stair-step process. So one at a time, monitoring for any reactions. So it's nice to have a little symptom log or journal that you can use to monitor those symptoms. Some of the questions that are asked around the elimination diet are vegetables. Am I allowed to have all vegetables, raw, steamed, sauteed? And the answer is yes. In most cases, yes. However, if you do have a history of arthritis or joint pain, it may be appropriate to remove nightshade vegetables as well. And those will be things like white potatoes, eggplant, peppers, tomatoes, chili peppers, and things like that. And this is because nightshades contain an alkaloid called solanine. And this can be toxic in certain concentrations to certain folks. So that is one with any type of joint pain, we'll usually go ahead and remove that. Fruits, most fruits are allowed. The exception would be if you do have some yeast, so a candida overgrowth, then we will want to kind of monitor that fruit intake because there can be a lot of sugar. So either limit or avoid, but that'll again be individualized. We also want to probably avoid like canned fruit because that can contain sulfur. And so some can be sensitive to that preservative. Grains, again, that is very individualized. Some we will do just gluten and some we will choose to do the full grains. And then some of the issues that arise that we're often asked about are when we do this elimination diet are kind of some gut issues. For example, constipation, because when we're removing some of those foods, we're not getting the fiber intake that we need. We know fiber is in vegetables, so plenty of fruits and vegetables. If you struggle with constipation, we want to really make sure you're getting enough fiber. So about 30 grams daily is kind of our goal. Plenty of hydration, activity, moving your body. You can try some chamomile or peppermint tea that can really help to calm the muscles of the intestine. Magnesium citrate is great in pulling water into the bowels to allow, a more formed soft stool. And then also buffered vitamin C can help as well. So if you have any type of constipation issues, those are all helpful additions. If you have any feeling of hypoglycemia or low blood sugar, making making sure that we're really eating plenty of healthy fats and protein to balance out is key. Coffee or sugar cravings, I don't know why, but sometimes that vitamin C can help with those sugar cravings. And I talked about this earlier with Christy, but sugar feeds more sugar. It's this vicious cycle that feeds on our receptor sites in our brain, that it's the pleasure center. And so when we have sugar, we're going to want more and more and more. And that goes for even those artificial sweeteners like Splenda, aspartame. So we want to really try to get rid of that as well, minimizing sugar. So, those are just some general tips as you're kind of introduced into this elimination diet. But really, the key is being prepared, asking questions, looking at some, cookbooks and some recipes. And don't think that it has to be these extravagant meals and fancy recipes. It can be very simple, a protein and a veggie. You don't have to get fancy. If you want to do something every once in a while, that's fine, but you also don't want to overwhelm yourself either. Those are some little tips. Do you guys have any questions on the elimination diet? It's super individualized, and that's the nice thing about this program. We'll guide you through it the entire time. We'll offer you resources. You have the modules as well to kind of guide you. But if you guys have any questions along the way, we are always here to help guide you. So it was a pleasure to have you both on, and hopefully, we'll have you join in the coming weeks. We'll do different topics and from week to week. And so if you ever have suggestions on a particular topic that you really want us to focus on, then feel free to message us. It could be completely anonymous, but we're always happy to kind of tailor that to your needs as well. Enjoy the rest of your week, and hopefully we see you next week.
Thank you.
You're
Thank
welcome.
you.
Okay. Uh-huh.
Bye.
Bye.